talk about mood management and anxiety management with kids. I think any adolescent could use skills in mood management and anxiety management. I think across the board, that is a skill we probably need to teach kids. I don't think they have to have a diagnosis of a mood disorder or an anxiety disorder to teach them those skills. So, I'm going to talk about things that I think are helpful for kids, whether or not we've tagged them with that label or that diagnosis. And part of that is that I don't think kids should have a label or a diagnosis before we try and assist them in just kind of learning how to control their world. The other reason I say that, and if you've ever heard me train, you know I say this all the time, we really overpathologize adolescence. We overpathologize it to the extreme. We diagnose every little thing. We have kids with multiple diagnoses. We get mad when the kids resist those multiple diagnoses, and that's not particularly helpful. It's not particularly helpful to do that. And I always say that I get kids who have been everywhere, done everything. I always say they've been fired by every good therapist in town before they get to me. And I always get these referral charts, and I'm like, okay, my secretary will say, here's your new client. I go, what's the diagnosis? And she'll say, OCD, BPD, ADD, OCD, and I just call them LMNOP kids. We get all the LMNOP. That should not miss anything. And then I think, seriously, first of all, when I look at that, how in the world, what am I supposed to do with that? Does that make sense? I mean, what in the world am I supposed to do with a kid who has 5, 6, 7 diagnoses? And if I feel that way, what is the kid supposed to do with that? I mean, good grief. What is the child supposed to make of this list of pathologies? And I think what happens is somebody diagnoses them and somebody puts a diagnosis on top of that. I think that comes down to very often what I call checklist diagnosis. They meet the criteria. Get to know the kid. Get to find out what's the core issue, what's the motivating force behind this. I mean, seriously, would you want somebody to do a checklist diagnosis on you? That's what we're doing. You meet the criteria, yeah, but stop and talk to them. I've had kids diagnosed with bipolar because they went nuts, and when you stop and talk to them, it's because their boyfriend broke up with them. Okay? Well, that stinks. That's a hard time for them. So I really think we need to be a bit more cautious about that, and particularly some of the really significant and serious diagnoses. We're diagnosing kids bipolar left and right. And while I think that is obviously a concern when kids have that, and I think it's a legitimate, valid diagnosis, I also know that every other kid I see is not bipolar. Every kid who has a temper is not bipolar. So I think we really need to kind of be cautious about that and approach it more like, okay, if you're having trouble with your mood, here are some things that you can do that will really help you with that. So I'll talk about the diagnoses, but more than that, I want to say, I think we have some broad application here. I love to tell this story about my mom. I have 7 brothers and sisters. I had a lot of kids in my family. It was kind of scary because when my dad would threaten to kill one of us, I always thought he would do it, because I used to look at my brothers and go, okay, there's 7 of us. Who needs 7 kids? I wouldn't put it past him to pull one out and make an example out of him, and he would still have 6 left. I mean, that's plenty of kids for anybody. So we get together and we're all talking, and my brothers are talking, and one of my brothers is like, I think Tawny has some OCD, and my other brother's like, well, I think Dusty has some ADD. And my mom looks at us and she goes, y'all people, you don't have enough kids. You got 1 or 2 kids, you're always looking at them. Because that's what we have, 1 or 2, 3 kids at the moment. We don't have 7 kids. She goes, you can't be looking at kids. You're bound to find something wrong with them. I never looked at y'all. Y'all are fine. Look at you. If I'd looked at y'all, I would have needed some Prozac, and there wasn't any back then. So quit looking at them. She goes, kids they're just weird. They just don't even know. They don't know why they're doing this weird stuff. And I think she's right. That sometimes we really just need to, step back and say, okay, how can we help the kid get through this without really kind of over-pathologizing this child? So hopefully, we'll be able to talk about some interventions that will help with that. And I also think the other reason we tend to diagnose kids is because of the language. They have these real languages of extreme, and we're always responding to that. And I always say you never want to respond to a moment with a kid because they have a lot of them. So you just don't react to that. Just sit back, calm down, ask them what's going on, ask them what they mean. I think that I think we just need to calm down a little bit. And then I wonder why, our kids are so anxious. What do you think that comes from? All right, we're going to talk about the physical dimension. And when I work with kids on mood management, anxiety management, I talk to them about the 3 dimensions, okay? The first dimension is the physical. The second dimension is the cognitive, which is the thinking. The third dimension is the emotional. okay? And the physical dimension includes for me things like lifestyle changes and those types of things. So I want to talk first, when we first start this morning, I'm going to talk about putting like anxiety and depression together in that physical dimension, because much of what we do is very, very, very similar. And here's the thing, when I talk about here are the things that kids can do to manage their mood, I know I'm not going to get 100% compliance to what I ask them to do. Okay? I don't expect that. I don't even really need that. But if I give them enough options, I can get them to do one or two things differently. And here's what I tell kids. You get better by doing lots of little things differently. That's how you get better. There's not one big thing. There's not one magic thing, whether it's medication, whether you get better by doing lots of little things differently. And so it can start, as far as I'm concerned, with one little thing differently. And I really try in my interventions with kids to make it as manageable, as simple, as short, as sweet as possible, because they're much more likely to do that. You know, so when we do cognitive therapy with them, we really break it down so they only have to look at a few thoughts in a couple areas as opposed to the 130 irrational thoughts that you can have. You know, so it's about taking all the research-based stuff, which is excellent, but making it fit much more for the population that we're trying to serve. And so when we do the cognitive piece, okay, it's cognitive therapy, but it's really kind of geared at the population that we're trying to treat. The examples and the way we approach that, and you know, the way we kind of help them isolate which pieces they need to work on. And we call this I'm miserable and you can't help me, because one of the things that we want to do are talk about some things that move kids along, that help them even if they don't want to work, even if they don't want to try, even if they're resistant to come into therapy, all of those things. I want to just talk about, as we go through the day, little techniques that kind of nudge them, okay, that get them to stop, that get them to think about things. And I talk about that in my training because we're in the age of canned programs, okay, and what we don't talk about are the little things in between those canned programs that can really get the kids to look at what we're trying to teach them. You know, it's not that we don't know what to teach them. We know that. We've known for years what to teach them. With kids, it's about getting them to do what we're trying to teach them. And that is probably, of all things with kids, the most difficult thing to do. And so I really try and integrate that into the discussion today is how do we nudge them along? How do we get them to look at things? What kinds of things do we say to them that are going to kind of spark their attention and get their attention?